everyone, my name is Daniela and I'm a volunteer at For a Safer Space. Today's video will be part 1 of a 2-part presentation on eating disorders. I would like to begin this presentation with a land acknowledgement. I am conducting this presentation on the traditional territory of the Mississaugas of Scugog Island. While it is important to acknowledge which land I'm on, it is equally as important to understand why we engage in a land acknowledgement. First, acknowledging the land is an act of decolonization. Decolonization is an act that aims to reverse colonialism. It is also significant in understanding history and acknowledging history, as well as showing respect for indigenous peoples and their relationship to the land. However, it is important to not only use the land acknowledgement, but to educate ourselves on historical and current issues, stand with indigenous peoples in the pursuit of social justice, and decolonize our thoughts and actions. Today's agenda will include a brief introduction followed by what are eating disorders, types of eating disorders, why are eating disorders so dangerous, statistics, risk factors, warning signs, can eating disorders be about more than food, treatments, and to conclude, resources and key takeaways will be discussed. Eating disorders are severe mental health disabilities that result in physical manifestations. These physical manifestations are persistent behaviors surrounding food and eating that impact physical and mental health, as well as someone's ability to function in various areas of life. The 3 most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. There are various risk factors that can impact the development of an eating disorder. While eating disorders are serious and can be life-threatening for various reasons, there are steps individuals can take to manage them. What are eating disorders? As mentioned, eating disorders are serious mental health disabilities that impact behaviors around food and eating, which can have severe adverse effects on mental and physical health, as well as one's ability to function in various aspects of life. Many eating disorders consist of focusing too much on weight, body shape, and food, which results in severe behaviors around eating. This can affect one's ability to get proper nutrition, which can impact the heart, digestive system, bones, as well as teeth and mouth, resulting in other diseases over time. Eating disorders commonly begin in teen or young adult years, however, individuals at any age can develop this mental health disability. With the appropriate resources, many can minimize harmful behaviors and reverse other health complications. The next section will discuss different types of eating disorders. 6 of the most common will be discussed, including anorexia nervosa, bulimia nervosa, binge eating disorder, pica, rumination disorder, and avoidant restrictive food intake disorder, as well as other less common eating disorders. Anorexia nervosa is the most well-known eating disorder. Typically, symptoms begin during teenage years or young adulthood, and it impacts more women than men. As well, the eating disorder can result from individuals viewing themselves as overweight, resulting in the constant monitoring of weight, avoiding specific types of food, and restricting calories. Symptoms common to this eating disorder include being underweight, restricted eating habits, intense fear of gaining weight or continuous behaviors to avoid gaining weight, severe influence of body weight or perceived body shape on self-esteem, and a distorted body image. In fact, obsessive-compulsive symptoms can also be prevalent, and this relationship will be discussed in part 2 of this presentation. Finally, it can be common for individuals to have difficulties eating in public. Similar to anorexia nervosa, bulimia nervosa typically begins during teenage years or early adulthood, often being less common in men than women. With this eating disorder, individuals often eat large portions of food during specific periods of time. A binge eating episode can continue until someone is painfully full. However, they may not be able to stop before this as they feel they cannot stop or control how much they are eating. Binges can occur with any type of food, but most often occur with those the individual typically avoids. This is often followed by periods of purging to compensate for whatever calories were consumed. Symptoms can be similar to other eating disorders, however, individuals often remain at their weight. Common symptoms of this eating disorder include recurrent episodes of binge eating where the individual loses control, recurrent episodes of purging behaviors to halt weight gain, self-esteem is often influenced by body shape and weight, fears of gaining weight, and side effects of this mental health disability can include inflamed and sore throat, swollen salivary glands, worn tooth enamel, tooth decay, acid reflux, irritation of the gut, severe dehydration, and issues with hormone levels. This can also impact electrolyte levels such as sodium, potassium, and calcium. Binge eating disorder is said to be one of the most common eating disorders. Similar to others, it often develops during adolescence or early adulthood, but can begin later on. Symptoms are similar to bulimia nervosa or the binge eating subtype of anorexia nervosa. For example, it is common for individuals to eat large amounts of food and lose control during binging episodes. However, what is different about binge eating disorders is that individuals do not restrict calories or engage in purging behaviors. Common symptoms of this eating disorder include eating large amounts of food in short periods of time in secret, whether or not the individual feels hungry, a lack of control over binge eating during these episodes, feelings of distress when thinking about the behavior, and a lack of use of purging behaviors. Pica is an eating disorder that involves eating non-food substances. This can include ice, dirt, soil, chalk, soap, paper, hair cloth, wool, pebbles, laundry detergent, or cornstarch. People of all ages can live with this eating disorder. However, it's most common in children, pregnant people, and individuals with mental disabilities. Individuals living with pica may be at heightened risk of poisoning, infections, gut injuries, and nutritional deficiencies. Depending on which substance is consumed, this can be fatal. For eating behaviors to be considered pica, it must not be a normal aspect of the individual's culture or religion, or considered a socially acceptable behavior by the individual's peers. Rumination disorder is a newly discussed eating disorder. This eating disorder is where an individual regurgitates food they have chewed and swallowed, re-chews it, and then re-swallows it or spits it out. This often occurs within the first 30 minutes after eating. This eating disorder begins at any point in life. In infants, this eating disorder can often occur within 3 to 12 months and commonly disappears on its own. However, children and adults often use therapy as a way to help resolve it. Avoidant restrictive food intake disorder, or ARFID, typically develops during infancy or early childhood, but can still continue into adulthood. As well, it is equally as common among genders. This eating disorder results in disturbed eating due to a lack of interest in eating or distaste for certain smells, taste, colors, textures, or temperatures. Common symptoms of ARFID include avoiding or restricting food intake, resulting in insufficient calories or nutrients, eating behaviors that interfere with normal social functions, weight loss or improper development, and nutrient deficiencies. This does go beyond normal picky eating commonly found in toddlers and does not consist of avoidance or restriction due to issues of availability or cultural practices. In addition to the eating disorders mentioned, there are other less common eating disorders which can be placed into 3 categories, including purging disorder, night eating syndrome, and other specified feeding or eating disorder. Purging disorder consists of purging behaviors including vomiting, laxatives, or excessive exercising as a means to control weight. However, individuals do not binge. Night eating syndrome consists of frequently eating excessively, especially after waking up from sleep. Other specified feeding or eating disorder, or OSFED, is a category for any other eating disorder that may not fall into the other categories. Why are eating disorders so dangerous? Eating disorders can have serious impact on one's mental and physical health and can impact every organ system. The cardiovascular system can be impacted as the body begins to break down its own tissue to replace food. This impacts blood pressure and pulse rate as they decrease. Eventually, it can lead to heart failure. As well, electrolyte imbalances can result in irregular heartbeats. Additionally, the gastrointestinal system is impacted through slow digestion, constipation, inflamed pancreas, or intestinal infections. The neurological system can be impacted as individuals may have troubles falling or staying asleep, muscle cramps, seizures, or dizziness and fainting. The endocrine system is impacted as hormone levels are affected, which results in bone loss, insulin resistance, temperature drops, and high cholesterol levels. As well, for people who menstruate, there can be irregular or stopped menstruation. Finally, there can be other health consequences such as dehydration, resulting in kidney failure, less white blood cells, which help to fight against infections, anemia, as well as others. Now we will go over a few statistics to demonstrate how many people are impacted by eating disorders. About 1 million Canadians have been diagnosed with an eating disorder. Eating disorders have the highest overall mortality rate of any mental health disability, with this percent being between 10 and 15%. After cardiac disease, suicide is the second leading cause of death among those with anorexia nervosa. In fact, 20% of those living with anorexia nervosa and 35% of those living with bulimia nervosa may attempt suicide during their life. For females 15 to 24 years old, the mortality rate for anorexia nervosa is 12 times higher than that of all other causes of death combined. There are various risk factors that can heighten an individual's probability of developing an eating disorder, and they can be broken up into 3 categories: biological, psychological, and social. Biological risk factors include having a biological relative with an eating disorder or mental health disability, a history of dieting, or type 1 diabetes, which has been shown to have relation to eating disorders, specifically by skipping insulin injections. Psychological risk factors include perfectionism, specifically oriented towards the self, body image dissatisfaction, history of anxiety disorders, and behavioral inflexibility. And finally, social risk factors include weight stigma, harassment and bullying, acculturation, individuals find themselves isolated, and intergenerational trauma. Now we'll look over warning signs of eating disorders. It is important to note that not all individuals will have the same signs and symptoms, and they can vary depending on which eating disorder an individual has. There can be two different categories, including emotional and behavioral, as well as physical. Emotional and behavioral warning signs include behaviors that hint towards weight loss, dieting, or control of food, preoccupation with weight, dieting, or various aspects about food such as calories, carbohydrates, or fat grams, avoidance and refusal of certain foods or a category of food like carbohydrates, discomfort eating around others, food rituals, skipping meals or eating smaller portions, new food practices or diets, withdrawal from friends or activities, frequent dieting, extreme concerns over body size and shape, and extreme mood swings. Physical warning signs include noticeable fluctuations in weight, stomach cramps, dizziness especially after standing, fainting, extreme coldness, difficulty sleeping, dental issues, fine hair, muscle weakness, and impaired immune function. Can eating disorders be about more than food? While eating disorders can commonly relate to body image and weight, there is another major reason that individuals may develop an eating disorder, which is control. This is connected to what tends to be feelings of powerlessness and a lack of control with life stressors. This offers one area where individuals can have control, which results in unhealthy coping mechanisms. This can be further broken down into different facets of control under external locus of control. External locus of control is the understanding of how much an individual believes that they are in control of their life circumstances. The first facet is feelings of ineffectiveness. This is founded on perfectionism and self-criticism, as individuals feel that they have minimal control over their life circumstances. Additionally, there is fear of losing control, which can be impacted by thoughts about not living up to standards. Losing control over one's body derives from ideologies about their body in relation to clothes or weight. As well, losing control of one's identity is impacted by beliefs about how others may view them, and finally, losing control of one's emotions, such as losing a safety net. Now we will go over treatment options available. Treatment is often done through a team consisting of primary care providers, mental health professionals, and dietitians that have experience in eating disorders. Treatment also varies based off of the type of eating disorder, but often will include three different aspects, the first being healthy eating. This is where the individual and their team create a plan so that they can work towards healthier eating behaviors. Next is psychotherapy, which is used to assist in learning how to replace unhealthy habits with healthier ones, often used as family-based therapy or cognitive behavioral therapy. Finally, medications may be prescribed. While they do not exist for an eating disorder, they can assist with the symptoms of other mental health disabilities that play a role in unhealthy eating habits. Medications often prescribed are anti-anxiety medications or antidepressants. In severe cases, sometimes doctors recommend hospitalization, either inpatient or outpatient, when individuals have severe malnutrition. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. To conclude this video, we'll go over some key takeaways. Eating disorders are severe mental health disabilities that result in physical manifestations through altering behaviors around food and eating. This can have severe adverse impacts on physical and mental health, as well as various aspects of daily functioning. There are various types of eating disorders, including anorexia nervosa, bulimia nervosa, binge eating disorder, pica, rumination disorder, and avoidant restrictive food intake disorder, as well as other less common eating disorder categories. There are several risk factors that can heighten someone's probability of developing an eating disorder, which can be broken up into three categories: biological, psychological, and social risk factors. To continue with some key takeaways, additionally, there are warning signs for eating disorders that fall under two categories: emotional and behavioral, as well as physical warning signs. Eating disorders can be about more than food or body weight. Some scholars argue that the aspect of control can play a large role in the development of an eating disorder. And finally, there are a few treatment options available, which often rely on a team and consist of healthy eating plans, psychotherapy, and medication. However, in severe cases, inpatient or outpatient hospitalization may be suggested. To continue with this topic, the next video will touch on eating disorders as well, covering topics such as comorbidity, misconceptions, and coping with eating disorders. That concludes part 1 of the 2-part presentation on eating disorders. Thank you for watching.